Welcome to Breastfeeding Education with your girl Jazz. Today we're going to be talking about 5 things you should know before you breastfeed. If you're interested in this video, continue to watch. I am a registered nurse, soon to be lactation consultant, and I'm here to spread the good news, okay? I'm not here to shame moms that do not breastfeed. I am not here to put breastfeeding above bottle feeding or pumping or formula feeding. My motto is fed is best, okay? But if you're wanting to know more about the breast, I'm here for all the education needs, okay? I got all of them. I have them right here. Okay, so let's hop right into it. Breastfeeding currently is a sensational topic. I do not like to say, oh, pick a side. You can't do both. Can't be pro this, can't be pro that. You know, do it where it's best for you. I don't think there's a place to exclude anyone. But today, and my job is to provide breastfeeding education and to make moms feel, you know, phenomenal, whether they breastfeed or whether they do not. So the first thing you need to know, when you are breastfeeding, girl, you are bomb. You're amazing. You are that one. Okay, you are she. She is you. You is her. Grammar right now, it's all about jokes. But on a serious note, you did the most amazing thing that, you know, was the hardest possible journey you could embark on, with so many twists and turns. And for you to even choose that, whether, you know, it came under the circumstances that you would have liked or not, you are amazing. All right. Don't worry about what people say. This is the thing I tell my patients in the hospital. Lie. I know. Don't condone lying, whatever. But I do tell my patients, lie to your friends, lie to your families. If someone is pressuring you, what's the difference between lying and, you know, them knowing what you're doing with your breast? It's none of their business. They cannot make you feel insecure, inferior. Okay? It's all about trying your best and trying the best you can for your baby. And listen, you're already there. You're already doing it. That's the biggest thing after having a baby, is a lot of times the first day, within the first 24 hours, you know, moms are always like, I don't produce enough milk. Woo. Yeah, okay, I understand that. Let's slow our roll. We're not even there yet. But also, don't let those outside factors of people talking to you about what you should and should not be doing at whatever stage for your baby. Those are external factors. Let's get to what we need to for us, and everyone's journey is different. So baby, you're amazing, okay? Fed is best. I don't care about anything else. Is that baby getting fed? All right then, we won. That's it. That's the difference between life and death. That baby getting fed. Number 2. All right, if you didn't know, breastfeeding involves nipples and the breast, right? But if we don't use proper mechanics, proper skills, proper tools, those nipples, they're going to be raw. They're going to be raw. And I usually like to say the first 2 weeks are the worst. Let's see if we can push it to the first 2 weeks. First 2 weeks are the worst 2 weeks ever, because your nipples have never been stimulated that much, that many times, for that often. All right, they've never seen the light of day. And even, you know, moms that have breastfed before oftentimes say the same thing, like, wow, my nipples. Yes, we're going to try to keep them intact. That's the goal. Number 1, try to keep those nipples going, but there's going to be some discomfort. There's this saying that people, when I was learning about breastfeeding, people would say like, oh, breastfeeding is painless. Everyone's pain scale is different. I had this mom one time, you know, it was so painful for her. I was going to catch the baby from her throwing the baby, just because it was that painful for her. And that's not her fault. Her pain threshold is different. And in that area, it was it was lower. It was a lot lower, her tolerance. So we want to toughen those nipples up. I usually say about 2 weeks. I would not suggest stimulating your nipples before you deliver because that can induce delivery. And if you're not at term or whatever, now if you're term, whatever, do your thing. But I wouldn't want to stimulate those nipples or overstimulate them. Listen to what your doctor says. I'm not a doctor, but I would not recommend toughening the nipples up beforehand. Now, yeah, we're going to leave it at that. Leave that up to your doctor, okay? Number 3 is supply versus demand. We all know about industries. Supply drives, or demand drives supply, right? And so if there's a demand for breast milk, your body, a lot of the times, the way it's supposed to work is it will increase the supply. So the first 3 days are pretty much really the first 24 hours, but I like to extend to the first 3 days are the most crucial. Feed that baby. Whether it's on schedule or not, we go off of cues. We don't go off of time schedules. Now, there is a time stop where it's like the baby has to eat at this point, but that's if the baby didn't want to. I always wake my babies up out of their sleep to feed. I know that sounds crazy, but demand is supply. And so if the baby's sleeping, because their first 24 hours, they kind of, they're delivered, they're so exhausted from that delivery, and then they, first 24 hours they're out, or 18 hours they're out, you're not getting any demand. And in order to create artificial demand, a lot of times what we do is we stimulate with our hands. We also use the pump. We have dad stimulate. We snuggle skin to skin. Those type of things to help with that. So the first 1 to 3 days, you're just getting colostrum. I know it looks like nothing. Looks like little licks. But it's a baby. The baby's tummy is only the size of like a cherry when they're first born. That's all they need. And then it grows day to day. And so I usually say the first 3 days, you're not even, moms are like, well, where's my milk? You're not there yet. Sow your roll, baby. I got you. I'm going to tell you when there's a problem. I'm not going to just be like, in my head like, damn, she out the game. I would communicate that to my patient. But the first 3 days, we're just learning the body at this point. We're learning baby, we're learning you. So let's give the body some time to kind of figure things out. All right, day 3 to 5, I usually say is when you should start to notice a supply increase. This is when, the colostrum starts to transition into milk or regular milk, because colostrum is milk, but this is more abundance of milk, if you will. The breasts become a lot more fuller. They become fuller up top. The veins are a lot more pronounced. This can be a transition. If you don't take advantage of it, it can transition into other issues. But 3 to 5, I usually say that's more of what your milk supply will start to look like. And then I just say 6 days on, we're talking maintenance. We're going to either try to get your supply all the way up to where, it's adequate for baby. But usually we're just talking, we're in the groove. And from there on out, we can alter, tweak. Things are not going to be what we always expect. And that brings us to our next point. Number 4, plans are going to change. Don't guarantee anything. I never, even as a normal nurse, I've done other things outside of maternity. Actually, my job now is not in maternity, but I always say I can't guarantee you that, because baby, verbal contracts for these patients are real. They are everything to the patient. And I understand that you are trusting, people you don't know to deliver things that they say are supposed to happen or occur. So when they don't, that's disappointing. But as far as babies, pregnancy, having kids, the first day you become pregnant, just know, planning, nothing, that's out. That's plans, what? That's done for the next rest of your life, the next lifetime, all right? Because kids are going to throw that off. But with breastfeeding in particular, baby may not latch. You may not have enough supply. There's lack of sleep or sleep schedule. Nothing's going to go to plan. I always tell my patients, you succeed best when you're flexible. Because the more you stress out about every little detail, and I know that's hard to trick your brain to calm the hell down, but the more you chill out, the more your body can relax. Breast milk does not come from a stressed lady, all right? If you ever seen a stressed out cow, they're not making milk. Okay, if you think about stress, right? Stress is like cortisol, fight or flight. Your body is going to reserve all the extra things that it is doing, all the extra processes, all the magic that it can do. It's going to reserve that for the necessary. It's going to reserve all those things for what is necessary. That's it. So baby, we're conserving now. We are in famine, and so that's how your body responds to that. And there goes the breast milk too. That also is your letdown. If you are stressed and tense, your letdown is not going to happen. So that's why this is such a big tip. No one, I mean, you know you're going to be stressed out and tired, but like you got to start working on some calming techniques before you get to the game day, or the game days, or the playoffs for the rest of your life. But specifically with breast milk, stress does not equal breast milk. And number 5, please take all the help you can get. Pet peeve is when I'm in the hospital and I see a mom, and you know, even if I ask, like, can I do something for you? Find something. Say something. Find something. Don't go just bending, doing, carrying. I know everyone wants to be a superhero. There are going to be days where you'll get your chance. There'll be days you'll get an opportunity. More will come. But don't take it all on if you don't have to. So you'll be tired, you know, so when someone gives you an opportunity to sleep, take that. You want to meal prep, someone is offering meal preps or meals or gift certificates, take that. Naps, take as many as you can, when you can, how you can. 5 minutes, 10 minutes, 20 minutes, girl, 30 minutes. That's like, you know, you're well rested after 30 minutes. It's like, I'm playing, but like, seriously, any amount. I always say, even if you close your eyes for 10 minutes for me, I'll take, baby. Close your eyes give me 10 good minutes. Don't sit on your phone for those 10 minutes. When I leave, even if you're closing your eyes just to meditate and regroup, do that. Take that. Let somebody wash your clothes, okay? I don't know where you are in some of those 5 things, but just think about them as you prep, plan, or educate others, you know. These are some important things you should know before breastfeeding, okay? I have other educational videos on my page. I want you to go ahead and try to check them out for me, or for yourself. I mean, you know, I do know the information. I mean, I want to share information that I know, and sometimes stories along the way. You know, this was Breastfeeding with Jess.